All right, so you've started to lift heavy and you start to get some elbow pain. You'll get it in one or two places, right? I'll actually show you on Nadine, it's a little easier to show. You either get it on the outside of the elbow, lateral epicondylitis, which is usually from gripping too hard and going into wrist extension, or you start even getting it on the medial elbow, and that's actually from gripping and then turning in like this, right? It's another way that you try to get some more grip strength. So when you start getting this problem, you need to knock it out or knock it off, right away, right? So it's like, the problem is we get patients coming in who've been dealing with this for several months because they just keep going and going. And when you do that, this part of the muscle, the tendinous part that originates here at the elbow, will actually get a little bit of tearing and degeneration. And then it's really hard to heal because there's not a lot of blood supply there. It's really frustrating for you and for us, right? Because we want it to get better. So at the first signs of this, if you are doing an exercise where you're pulling or there's a lot of gripping and you feel pain there, a couple things I want you to do right away. The first thing is to try to do some soft tissue massage on this. And what I usually tell people, everyone has a kitchen knife. We'll pretend the reflex hammer is a kitchen knife. And the handle of it's usually dull like this. And so you can use that broad edge to just gently go up and down. So you just need lotion. We actually use a makeup remover, Albolene, here at Mission Move. And so just something that's a little bit of a lubricant to reduce some friction. And then, here Nadine, hold that. Okay, so then it's sort of like the key with this is just to relax your arm like this. So hold your arm like that, and then take the broad edge and just go up and down the arm there, just like that. Up and down. It shouldn't be like you're trying to make your arm turn red or bleed or anything like that, just really gentle. And if you just spend like 5 or 10 minutes doing that, that will help quite a bit. Or you can else use a lacrosse ball and just go up and down the muscles on both sides like that. You can also do the knife. They do make massage tools that you can buy on Amazon that are kind of blade-like that you can do. But honestly, a knife works just as well. And then the other thing is just to try to do gentle stretching. So don't crank on it super hard. The easiest way to do it is just get to a table, something like this, where you basically, might not be able to see that, okay? So you just put your palms down and just kind of shift your weight for gentle stretching, or this way, all right? So now we're gonna show you a couple different ways that we start working with people and some techniques to start getting rid of this elbow pain when it comes to what you're actually doing in the gym.
So one thing to be aware of when you're lifting is going to be the position of your wrists. So neutral wrist is going to be the goal for most exercises where you're holding dumbbells, barbell, pushing or pulling. So when you're here and you're putting tension through that grip, you're getting a lot of the flexors, so that's the inside of your arm. And then when you're going the other way, this is what we see more often. You're getting a lot of the extensors, so the back side of your arm here engaged. So these extensors attach into the elbow right here. So that neutral grip is going to be really important. So one exercise where we see this a lot is barbell and dumbbell chest press. So first I'm going to demonstrate it incorrectly. So people bring the weights up, and then as you can see with my wrists, I'm letting the weights kind of rest into my hands and gripping on with the back of my hands facing me, and then go into that chest press. So what you want to do is straighten out that wrist and press just like that. So when you have that neutral grip, you're getting a co-contraction between your extensors and flexors in your forearm, and it's going to be less pressure on one versus the other. So from there, Joel's going to show you a pull-up. And we're really watching his grip here. So what people do incorrectly is they hold on top of that bar and they're really getting one side of their forearm engaged. So if you use that neutral grip here and perform your pull-up that way, good. Then you get that co-contraction, extensors and flexors, and it really shouldn't bother your elbow as much.
Yeah, this is one where people don't think they're gonna have an issue with it because it's just like, it's a pull-up, right? You're not thinking about your elbow, you're thinking about your back and your biceps and stuff. But because the muscles cross the elbow, and you're going full extension all the way up, or you should be, you will start to feel it there, especially as you're having to increase your grip to hang on.
All right, so now Joel is gonna show an exercise that is really good for actually strengthening your wrist and working on that neutral grip. So you're gonna take a kettlebell, you're gonna put it upside down and hold on to the handle, and you're just gonna do overhead shoulder press. Joel is demonstrating this.
It's a hard one.
In a kneeling position. So that's also gonna work your core and work on some stability there. But this is a great one to practice keeping that wrist in neutral and really strengthen shoulders and forearm.
Okay, so the take-home message for this video is, as soon as you start feeling it on either the outside or inside of the elbow, make sure you modify what you do and start doing some gentle massage and stretching right away. We also don't recommend ice or ibuprofen when you just feel it a little bit too, because that's when you'll tend to overdo it, and that's when you'll create an actual injury. If you're watching this and you feel like you've gone a little too far, you have an actual injury and it's not going away, treating it with dry needling, which is what we do, tends to be our most powerful tool in trying to get you some quick relief. So if that is you, please let us know. We would be happy to help you out with some dry needling.
Yes, the longer the inflammation is in there, the harder it is to get rid of. So try modifying that grip when you're doing your lifting at the gym, and hopefully it'll get a little better. If it doesn't, come on in and we'll help you out.
All right, if you have any other questions, please reach out.